Welcome back to the deep dive. I think it's safe to say you're here because you love knowledge and you like to get to the heart of things. No fluff, just the good stuff, right?
Right.
And today, we're really zeroing in on something that I think hits close to home for anyone who likes to move, likes to be active, likes to stay healthy. What happens when we get injured, especially if we're not, pro athletes?
Yeah.
So we're going to dive deep, as the name suggests, into this concept that an injury is an injury, the body keeps the score.
Right.
It's a powerful statement, and we've got some really fascinating research to unpack.
Absolutely. And I think the goal today is to help you understand what that phrase really means, practically for your workouts, your runs, your yoga, any way you like to move, and of course, how that affects your health over the long term.
All right, so let's jump right in. One of the first things that really struck me in the material we looked at is this idea that our bodies, they react to injury in a pretty similar way, no matter how that injury actually happens. It's like the origin story of the injury doesn't really matter that much.
Yeah, you're absolutely right. The research puts it really clearly. The body doesn't distinguish between a sports-related concussion and a concussion sustained in a car accident. It's
Yeah.
still a concussion.
Right.
Think about it. Whether you're tackled on a football field or you're in, a fender bender, your brain is still experiencing trauma.
Yeah.
And the body's physiological response is really to that trauma, that impact, not to the context.
So then naturally that gets you thinking, well, beyond the initial, ouch, that it hurts, I need to recover for a few weeks, period. What are some of the longer term things, the less obvious things that maybe we should be thinking about when it comes to these injuries, even the seemingly small ones?
You're hitting on a really important point.
Mhm.
Because, yeah, the research we're looking at points to some potential long-term consequences that we should all be aware of.
Okay.
And this can include things like a prolonged recovery.
What does that mean?
So that basically means it might take you longer to heal from future injuries.
Oh, really? Okay.
Yeah, your body's kind of got this memory, like, hey, remember that time we hurt our ankle? Yeah, well, let's be extra cautious this time. And then there's this increased risk of getting injured again in the same spot.
Oh, I see.
It creates a vulnerability, like a weak link in the chain. And then we've got chronic pain,
Ooh.
which obviously can have a huge impact on your quality of life.
Yeah.
If you're constantly dealing with pain, it's hard to do the things you enjoy. And then there's the mental health piece,
Yeah.
which, sometimes doesn't get talked about enough. But the stress of dealing with an injury, especially if it's long-term, can really take a toll mentally.
That's true.
And you know what? Here's the kicker. All of this, all these potential consequences, they don't just apply to the big dramatic injuries, the broken bones and the torn ligaments. Even those seemingly small sprains or strains can add up over time.
Right. It's like this cumulative effect that maybe we don't always appreciate. And that's where things get really interesting, I think, for people like you and me, for your average listener who's not a professional athlete, right? Our goal isn't to win the Super Bowl or the World Series.
Right.
Our goal is to stay healthy, to be able to keep moving, to enjoy all the things that make us feel good for as long as we can. And that changes how we need to think about risk when we're being active.
You're absolutely spot on.
Yeah.
Because a pro athlete, they might decide that the risk of pushing through an injury is worth it because they have a huge game coming up. Or it could be a career-defining moment.
Yeah.
Plus, they've got access to, the best medical care, top-notch rehab. But for us, everyday folks, I think the sources make this really clear. Risk management is paramount. We've got to be smart about this stuff.
Right.
Our primary focus has to be protecting our long-term health and well-being so we can keep doing the activities we love for years to come.
Right.
And, that means making choices that minimize the chances of getting injured in the first place.
And that means challenging some of the old mantras, the things we've heard our whole lives, like no pain, no gain.
Oh, yeah, that one. You hear it in gyms, on the track, everywhere.
Everywhere, right? It's almost like a badge of honor.
It is. But I think especially for non-professionals, us regular folks, that's a really dangerous way to approach exercise. I mean, a little bit of discomfort, sure, that's normal. But if you're pushing through actual pain, that's a red flag.
Yeah.
That's a sign that something might be wrong. And you're setting yourself up for a potentially bigger problem. And, another piece of this is that rest and recovery, they're not signs of weakness, like some people might think.
Right.
They're actually essential. They allow your body to repair and rebuild. It's like, think of your body like a car.
Okay.
If you ignore the check engine light, sure, you might be able to drive for a while longer, but eventually you're going to break down.
It's preventative maintenance. And it's not just the external pressure, right? Like trying to keep up with a super fit friend or pushing yourself too hard in a class. I think sometimes we put that pressure on ourselves, too.
That's such a good point. It's like this internal drive, this voice in our head telling us we need to do more, be better, push harder. And sometimes, maybe a little bit of ego gets mixed in there too.
Totally.
But, managing risk effectively also means managing that internal pressure.
So how do we do that?
It takes a lot of self-awareness. Being honest with yourself about how you're feeling, where your limits are on any given day, and making choices that respect your body's current state. It's about listening to that inner voice, but also being able to say, okay, maybe not today. Today's a rest day.
That's really powerful. And it kind of ties into something else that stood out to me in the research, this idea of normalizing injuries. You hear about people spraining their ankles, pulling muscles. It's so common. It's almost like we just brush it off as part of being active.
Exactly. And in some circles, it's almost like a badge of honor. Like, oh, yeah, I'm so tough. I worked out even though my knee was killing me. But, when we're talking about long-term health, that kind of thinking can be really detrimental.
So are you saying we should, freak out over every little twinge?
No, not at all. I think it's about finding that balance, right? It's about recognizing that even though these minor injuries might be common, they're still injuries. And as we've been talking about, each one has the potential to leave a lasting mark on our bodies. So respecting those signals and taking steps to prevent further damage is crucial.
So how do we actually get better at this whole risk management thing? It feels kind of vague, like, okay, manage risk, but how?
It's a great question, and I think a huge part of it comes down to body awareness.
Okay, I like that.
Really tuning in to what our bodies are telling us. The research actually talks about how a lot of adults, they've kind of lost touch with their bodies. We're so busy, so distracted, that we miss those subtle cues, those whispers from our bodies saying, hey, something's not quite right here.
Yeah.
So practices like yoga, tai chi, even just taking a few minutes throughout the day to do some mindful stretching or movement that can really help you reconnect with your body. And that connection is key to recognizing those early warning signs of a potential injury.
It's like learning to speak your body's language.
Exactly.
So you can understand what it needs. And it sounds like educating ourselves is a big part of it, too.
Yeah, absolutely.
Yeah.
And not just waiting until something goes wrong.
Right.
It's about being proactive. So learn the proper techniques for the activities you enjoy.
Okay.
Warm up properly, cool down properly, don't jump into things too quickly, understand how to progress safely and appropriately. There's so much great information out there these days. So yeah, educate yourself, be informed.
And what about when those little aches and pains do show up? Do we just ignore them?
I think the biggest takeaway here is don't try to tuss it out.
Okay.
We have this tendency to want to push through pain, to ignore those signals. But when it comes to injuries, that's often the worst thing you can do. So if you think you might have an injury, go see a doctor, go see a physical therapist, get a proper diagnosis, get a treatment plan. Don't rely on Dr. Google or your buddy at the gym.
Solid advice. And I think this all comes back to why we're exercising in the first place.
Absolutely.
It's not just about aesthetics. It's not just about performance.
It's about feeling good.
Right.
It's about feeling good in our bodies. It's about enjoying movement.
Yeah, exactly. And sometimes I think we get caught up in this idea of constantly needing to push harder, to do more, to be better.
Yeah.
But the research really emphasizes that for long-term health, that's not the best approach. It's about prioritizing our well-being, even if that means dialing things back sometimes.
They talk about how with professional athletes, the priority is always the athlete's health, right?
Right.
And I think that's a principle we can all apply to ourselves.
Yeah.
Our health, our well-being, those should always be our top priorities.
So wrapping this up, I think the big takeaway is our bodies remember. They keep score of every injury, every strain, every sprain. And for those of us who want to stay active and healthy for the long haul, that means being smart, being proactive, and taking care of ourselves.
Absolutely. We need to shift our mindset from no pain, no gain, to listen to my body, respect my limits, and prioritize my long-term health.
It's a powerful concept. So as you go about your week, I want you to really think about this. Knowing that an injury is an injury, the body keeps the score, how might you change your approach to fitness and movement? What small steps can you take to ensure that you're moving in a way that supports your long-term well-being?
Great question.
Something to ponder. Thanks for diving deep with us.
Yeah, thanks for having me.